I'd like to call the Heartland Continuum of Care April membership meeting to order at 9:02 a.m. Yesterday afternoon, Josh sent out an updated agenda that included our March minutes. Does anyone have any comments or changes to those minutes? Hearing none, the minutes will stand as presented. Is our presenter here yet, Josh?
She is. Karen just joined us.
Okay. Well, let's go ahead and get a report from Nick and give her a minute to take a breath. Okay.
That sounds good.
All right. Nick, will you give us an update on the emergency housing voucher?
Absolutely. Josh, if I can share the screen, I'll be glad to as well. Let's see here. All right, can everybody see that?
Yes.
Excellent. All right, everybody. My name is Nick Dotson. I'm the Housing Navigator for the Heartland Continuum of Care, housed at Helping Hands of Springfield. Some of you know me. Most all of you have had some interactions with me. If not, here's my contact information. I'd love to chat. I am a community resource. The emergency housing vouchers were started in the summer of 2021 by the federal government. Our community received 37 of those vouchers. Since we got them issued and my position was created August 31st, we have fully housed 31 individuals with the program. It's very much similar to housing choice vouchers, which is the new name for Section 8. We still have 3 folks waiting on inspections and 3 folks still searching for units. So the numbers still keep climbing. They're doing really, really well. Every day is I feel like progression in a lot of different ways. We are currently listed as 6th in Illinois for utilization of the emergency housing vouchers. So that's out of every housing authority in the state that's using this program. We are currently in 6th place for utilization. We're actually, with the updated numbers, we're in 5th place, to be completely honest, but that's what the tracker says currently. Further, we did receive a very generous donation of $10,000 to assist folks in the emergency housing voucher program. Of that resource, we have utilized $7,723 so far, and that has helped secure housing for 16 people, which I think is really incredible. So I just wanted to make sure everybody sees those numbers, how well they're rocking and rolling, and how essential that collaboration with those partnerships in the community are, and how thankful we are for that as well. So the EHV program, in my opinion, is going fantastically. We're hoping to get some more vouchers redistributed to us. We're not sure if it'll happen, but we are certainly optimistic. The next big excitement for us is the Landlord Risk Mitigation Fund. Sorry, I'm just kind of going right into it, Val.
Oh, you're fine. Go right ahead. You're good.
So as some of us know, the policy was something that we worked on for the last around 6 months. Josh, myself, Val, Amy, several others, took it and massaged this policy and got it into something that we think is really solid for the community. So what it is it's a new community resource for housing providers and agencies with supportive housing programs. The Landlord Risk Mitigation Fund is a partnership between property owners, managers, and service providers within the Heartland Continuum of Care. The program aims to mitigate the traditional risks associated with less stringent screening criteria, meet the needs of persons who otherwise could not access housing, and protect interests of landlords and service providers. So what this is truly just another resource that says, hey, I've got your back, of the agencies, of the landlords, and will do its best to keep folks from losing stable housing. So I wanted to further that the policy that we did write specifically does require rapid rehousing, permanent supportive housing, or the emergency housing voucher programs being utilized so far. This could expand in the future. However, this is where we are starting. Thus far, since the policy was released, we have received $30,000 in generous donations to the fund, which is incredible. So I think that's just such an amazing thing, and we're very gracious for it and grateful. And I think this is going to be something really cool and exciting that we can get a lot more landlords excited about helping, maybe reconsidering partnering with nonprofits, et cetera. So if anyone's curious to learn more about it, I would love to talk to you one-on-one. I'd come to your office, explain it to you, et cetera. I have a one sheet that I'm pretty much done with. It's kind of an explanation of it. in a brief way as well that I'd be glad to email after this meeting. I just need a couple more people's eyes on it to make sure there's not any errors, because I always like making a couple drafts of things. Anyway, that is pretty much ready to explain to folks. We just have to form a board and get the processes in place. So very excited about all of this. Just wanted to give everybody a little update on what we've been working on. This is a program unlike anything else in Springfield, and I'm really excited about it. I think that's all
All
I've
right.
got.
Thank you, Nick. Does anybody have any questions for Nick? All right, thank you. Maybe that one sheeter can be included in our agenda for next month as a way of distribution. Nick, once you get it looked at and are happy with it. So thanks, we appreciate it. Well, we're excited this morning to have Karen Kowal with us, who's from Homebase, that's doing the community-wide strategic plan to address homelessness. Karen, thank you so much for joining us this morning, and I'm going to turn it right over to you.
Thanks, Val. Good morning, everyone. I'm happy to join you today. I know Josh and I have kind of been trying to get me on the agenda for a few months, so I'm glad it finally worked out. Also because it's a point in time with the strategic plan that things are really have moved probably a long way from when you may have last had an update. And we're really getting ready to start finalizing things and start bringing it to the community and things like that. So I wanted to just I'll start with just an overview of what's been happening in case you don't know what's been going on, and even if you do, just to make sure we're all on the same page. And then we do have some data. We've been doing things behind the scenes of looking at your data, and we brought a few data points and talk about how those data points coincide with some of the draft strategies that the steering committee has been working on, and then talk a little bit about the implementation structure on what the steering committee is thinking and the directionality that it looks like they're heading in with how to implement the plan. I'm just going to talk it first before I show the data, because I think that it's really just a lot of talking. But so what's been happening thus far? And so we really started this process 9 months ago, or almost a year ago. But COVID, I think, kind of delays a lot of things because it's getting people used to meeting and things like that. But there's a really great steering committee here and with the Heartland Continuum of Care with Springfield and Sangamon County. It's a really diverse group of community leaders that are guiding the work. And so the steering committee was really structured to represent a variety of parts of the community in Springfield and Sangamon County. So the mayor's there, or the mayor's office, but the mayor does come to almost every meeting, which I think is pretty amazing. The county board is represented. We have 2 representatives from healthcare. We have the community foundation, the Land and Lincoln Community Foundation. So we have philanthropy there. We have I'm trying to remember everybody who's on there because there's so many people. We have service providers. Amy and Janita is and Jill are on the committee. We have just community representatives to show the diversity of the community. We have someone from, I'm trying to remember where Dominic's from. We have the Black Chamber of Commerce represented, and we have, I can't remember where Marcus is from. Sorry, Josh.
Springfield Urban League.
Marcus Johnson.
Urban League.
The Urban League, that's right. I always get the NAACP mixed up, so sorry. So we don't talk about where people are from most of the time, but and they've just really coalesced in leading the work, and it's really been great to see how they're really moving everything forward and holding on to the vision that we created and holding on to the aspect of diversity and listening to the community. So I think that those are all really good things. And so early this year, the steering committee, after hearing some of the findings we had with our needs assessment and through the community summits that we did in Springfield in November, they created 2 subcommittees to focus on 2 specific issues that lots of people were talking about all the time. And these will be of no surprise to you all, since you all are doing the work every day and the experts in doing this work. One was a behavioral health subcommittee, and the other one was a housing subcommittee. And so both of those committees were largely populated by people in the community. We did have representatives from the steering committee on both, and they kind of led the committee work with support from Homebase. And their goal was really to develop strategies and goals to bring back to the steering committee to incorporate into the strategic plan. And so they worked for about a month really intensely. Like, we really forced them to like get together regularly, quickly, just so we can get these things going. They presented these goals to the steering committee, and we've been incorporating them into the strategic plan. I didn't mention the steering committee also worked on other parts of things we know we need in Springfield and Sangamon County, like unsheltered goals and strategies, and goals and strategies around community communication. And so it's really this kind of holistic approach to that. And one of the ways that Homebase does strategic plans is we like to test and try some things about implementation while we're developing the plan. So one of the things that came out from the housing committee was that, this community, I keep calling it mine because I feel like I know you all so well. Springfield and Sangamon County, how they done, you get a gap of how to develop new housing, right? And so one of the things they wanted to do is look at how we would develop housing, and do we have all the knowledge and resources and things in the community to do housing development. And so the housing committee decided to continue meeting, which was great. And then we worked on this exercise to develop not only kind of like a plan of how you could do housing development, but also what some of the needs are and other resources that you might need to build your capacity. And so so that's basically the work of the strategic plan. Also, parallel to what we're doing, Lathan Harris is doing a racial equity analysis. And so those findings from Lathan Harris are going to be incorporated into what we're doing. So that at a real high level, that's what the steering committee's been doing. That's what the plan is. We're really to the point of the plan starting to look like a plan and not just a list of goals and strategies. And so we anticipate that next month there'll be a time where we're going to be showing the plan and having people look at it and getting a little bit of feedback and buy-in from the community to do that. And so, but that's part of the reason I'm here today too, is because the COC is of course an integral part of making sure the plan is successful. But you'll see when I go over the implementation structure, you're not the only ones making sure the plan is going to be successful moving forward, which I think is really good. And I think it really just aligns with all the work you all have been doing at the continuum to coalesce and work together and make improvements in the homeless system. But I think you all know that there's certain things that you need more help with. Those are the higher level things. When I do the implementation structure, I'll talk about that. But I wanted to talk about data for a minute, because I think personally, but also with Homebase, we're really passionate about, I'm going the wrong way with my slides, don't have enough coffee, about using data to make informed decisions. And so and moving forward, and the steering committee, that's really a common theme we heard in the community too. Community members wanted to know where the homeless system is at and see the progress you all are making. And so doing more with data is really important. We're really thankful to Tracy at Mercy for helping us get the data and helping us have it in a way that we can start the analysis. And so we just wanted to share a couple of things about the data, because we did a new analysis recently, and how the data is reflected in the strategic plan and some of the strategies that you'll see soon. So I wanted to start with inflow and outflow. I think for me, and what we see is it's very hard to end homelessness if you don't understand how many people are coming into your system and how many people are leaving and how much your system's growing because of what you're doing, or not growing. Hopefully there's reductions, right? So for me, this is always the first step that I like to show people. And so what this analysis is looking at your data from HMIS from January of 2016 until December 31st of 2020. So that's where the entry data comes in. So we're seeing you're having about 746 people enter the system in a given year. So those are people who are accessing services. That's their first enrollment. That's that's their interaction with the system. And then we see that your outflow is about 591, so pretty close to 600. And so these are exits from a similar time frame of January 1st of 2016 through December 31st of 2021. So exits means someone moves into a permanent housing project and they moved in, or they exited to a destination and they didn't return. So like I just wanted to be clear that we're not just taking the pure HUD exit, like you're going to permanent housing. We also feel strongly that like it's also a win or an outflow for the system if someone leaves and doesn't return for a specific period of time. And we took at least 14 months. So like they haven't been back in a long time. So that's a long-term success. And so your growth on average, and this is like a 5-year, almost a 5-year average, is about 155 people per year. So and that may sound really daunting, and it probably is, because 155 sounds like a lot of people who are newly coming in and your system is growing. If we do nothing, your system will grow exponentially and we'll never address homelessness properly. The other interesting thing on this slide, I think for the data perspective, is most of your inflow, your growth actually is from individuals who are over the age of 25. So this could be couples of 2 adults. So people without children who are over 25 is the vast majority of people who are coming into the system. And this is probably not new, like, wow, my brain just exploded information, because you all know this is happening. You see a lot of individuals in your system and things like that. So how do we, are we showing this in the strategic plan? Obviously, and I'm sure you all have been saying this for you, there's a huge need for additional housing to curb the inflow, right? And so we need to have more housing. And how do we do that? So some of the strategies actually, and I'm sorry, I forgot the previous presentation today, but it's really one of the ways that we see that is as a dedicated or comprehensive landlord engagement plan. And what was presented previously with the mitigation fund is like Springfield, and you all are already getting all of the pieces in for that kind of targeted landlord engagement to make sure people across the system are getting into housing. We're working with more landlords in the community because, and the next strategy, building new housing stock or creating new housing stock is a long-term effort, right? And so one of the recommendations and strategies is to create really a dedicated housing board. So there's a group of people in the community who are focused on how housing is developed in the community. So this could be a combination of people from the city and county who have access to resources to build housing. It could be developers who are on that board. It can be service providers. The key to that, and one of the key parts of that strategy, is having a dedicated staff person to do that work. So we all love Josh. We can't give Josh every single job in the continuum to do. And so having someone who really understands housing development and how to merge those resources and kind of match make those partners who are developers with service providers to create more housing is going to be key. So both of those things, having more landlords who are on board, who you're building on the great work that you're already doing because of getting a housing navigator, having your mitigation fund, how can we build those things? So that's how we see this slide relating to the strategies. And so I wanted to just talk about access. So whenever, again, with the inflow, we want to talk about how folks are accessing the system. These are just the key points that we found interesting, things that kind of piqued us to be like, oh, we need to understand that and do better with that. So one is like only 25% of the population has access coordinated entry. So and that's since 2019. So over the past like 2 to 3 years, only 25% of the people in the homeless system are accessing coordinated entry. Most of those are families with children. And then you'll see that individuals and youth are lower parts of that process. I think with the high number, you have a high number of individuals in your system and how they're accessing the system is really important. And these are things I think you already know. Female identified individuals have lower rates of access to shelter. Youth are more likely to access transitional housing than emergency shelter. That's not necessarily surprising. Nationally, we see that too. Youth are very hesitant to go into a congregate, especially a congregate emergency shelter. And then 7% of individuals, only 7% ever access permanent housing resources. So that's rapid rehousing, permanent supportive housing, or other resources. So a very low percentage are actually getting in to housing. Just a couple of notes about families with children. I'll talk about prevention in a minute, so BIPOC, Black, Indigenous, people of color are accessing homeless prevention at higher rates than those who do not. So that's just an interesting data point we saw related to race, and that families that identify as Black access shelter at higher rates than other groups. So how does this relate to the strategic plan? So a lot of the subcommittee conversations, especially with behavioral health, was increasing access to housing by making the system more housing focused. And so part of the reason individuals may not be accessing housing is because we're not having enough housing focused conversations in the shelter and street outreach systems. The other one, and I would say that some of you may know this if you follow the HIC and the PIC closely, is utilization. So even in some of the high level analysis of the PIT and the HIC that we've done, there are utilization issues both in shelter and transitional housing. So if you're underutilizing, this leads to the strategies of how can we improve those crisis response, the crisis response system, and those temporary beds like transitional housing and emergency shelter. And I say that not to say that anyone's doing anything wrong, but in order to end homelessness, we all have to work together in a similar way. And so one of the strategies and one of the things to do the first year is to really analyze shelter and transitional housing, how we can increase the utilization and make sure that all of our beds are being maximized to the greatest extent. Next, I just wanted to focus on returns to homelessness. So this is when someone exits one of our homeless programs to a permanent destination of any sort. When are they returning to the system? So these are any exits before 2021, and these are returns before February 2022. So the thing that should jump out to you is that a high percentage of people returning to the system who said they were going to a permanent destination from shelter, service only, or outreach programs. So shelter is not ending people's homeless experience. So that may not be a surprise to people who are on this call. I would say we also have concern with the percentage of people who are returning from TH. I mean, 25% may not be bad, but considering the high number of people who are in transitional housing, that so many are coming back, we should have some concern about those returns and why folks are returning after leaving to a permanent destination, as well as with PSH and RH. I mean, we always want to be working towards making sure that people aren't returning to the system. The big win on this one is prevention, right? Like your prevention program, homeless prevention program is doing an amazing job of ensuring that people aren't coming back into the homeless system. So how can we address, and I also want to say in parentheses, there was a large amount of missing data. So no one's data in any community is perfect. So don't feel like this is an odd thing, especially with shelters. So shelter exit data is hard. There was a lot of missing data, but I think we feel this is still significant because of the high percentages, and there was enough actual data to make these conclusions, and we can feel strongly about them. If we didn't feel strongly about them, or that we felt that they were shaky, we wouldn't be presenting them today. So there is missing data, but we feel good about this analysis. So how does this link to the strategies? So
Karen, can I interrupt you for just
Yeah.
a second? Can you explain how you measured the prevention? The prevention fascinates me, always has. How do you measure that? Or how do you look at that data? What is it you're looking at?
So I know Tracy's on. So there's homelessness prevention programs, projects
Right.
in HMIS. And so we look at those who entered into those projects and then those who were exit. And then we look to see if they came back into the system at any point in time. I mean, generally homeless prevention is an exit to permanent housing because we're keeping them in the permanent housing they have. So those are just folks who are in HMIS in those homeless prevention programs who were enrolled and exited.
Okay. Yeah.
Nothing magical about
Okay.
that one. So in regard to strategies for the strategic plan, the emergency shelter numbers are a big percentage. So like, how do we make sure people don't return from shelter? This could be looking at how services are delivered, making sure there's community-wide standards of how we're working with folks, how we're maintaining our data, how we're ensuring that they're leaving and we're recording the right things. But really the service delivery and being housing focused may be one way. But really, and this is the thing that the Behavioral Health Committee talked a lot about, is coordination, connections to referrals, especially from other systems of care. So whether that's the behavioral health system or physical health, or it's child and family services or whatever, to ensure that people remain stably housed. So making sure people have the services they need and they're engaged in them upon exit, so they're more likely to be stable when they leave. And so there's different like strategies and things that we've put in there, but really this coordination and referring and working together. And the other one that the Behavioral Health Committee was really passionate about, I would say, and I think this is really true, is making sure that those folks who were recently housed have, we expand those supports. So like this data is once you leave PSH or rapid rehousing, like what happens. So, but really like making sure once they get in their housing program that they have the supports they need to be stably to kind of move forward and have that process of being engaged in services and having the support and doing all the things that they need to do. So that's another way to attempt to reduce these numbers for returns to homelessness. We wanted to like just show some of the unsheltered population data. I think do not have to tell anyone here that there's a lot of people experiencing unsheltered homelessness in Springfield and Sangamon County. We found that you're averaging about 223 people coming into the system 223 people coming into the system per year who are unsheltered. By and large, thankfully, I will say that they are individuals without children. And then in this data, we included youth because we do have pretty low numbers of youth in the system. Interestingly, of those adults who are over 25, almost 40% of them had experienced unsheltered homelessness at some point in their homeless experience, which feels like a really high number, that at some point, a lot of people are being unsheltered. So also interesting with your demographic data, this is kind of contrary to what we see in other communities. We see females, individuals being unsheltered at higher rates than males. And so generally we see the opposite of more men being unsheltered than women. The other interesting points is that most unsheltered persons do not access housing. Most of them are only engaged in your street outreach, your services only, and your emergency shelter. So, and it is a high percentage, like only 16% of your unsheltered population do we know went to a permanent destination of any sort, and really less than 10% are exiting to permanent housing with any supports, and like less than 7% have a move-in date for their final enrollment, so that they, like, that means that if they were in PSH or rapid rehousing, they actually moved into that unit. So less than 6 or 7% are doing that. And similarly, less than 6 or 7% have recorded a move-in at any time that they've experienced homelessness or unsheltered, or in that going into that permanent destination. So this is just to emphasize, lots of unsheltered people are not accessing permanent housing. So some of the strategies you'll see in the plan are greater coordination between outreach teams. You all know that there's outreach teams for veterans and for the general homeless population. We see behavioral health hospitals having outreach teams. And so how can we get all these teams to coordinate and work together, avoid duplication, and ensure that everyone's being housing focused? And then the second one, probably no surprise, is increasing the number of the unsheltered population who are getting into housing. So because of those low percentages, the plan will have specific strategy around housing unsheltered folks, which may mean different implementation things for the system in Springfield and Sangamon County.
Karen, I just had a comment on some of that. I'm just wondering, with the talk of HUD picking up the, I guess, the description or the qualifications for homeless to be more like the McKinney-Vento, where it will be looking at doubled up and those kind of things. I just see, when I was looking through that most of the families that I work with that have school-age children, they find some place to go because they have kids, and you've got more people willing to take them in because they have small children. And I guess I just see in my job a lot of homeless people that are not even in this count at all, because they have farmed 3 of their kids to grandma, 2 to an aunt, somebody else, but the parents themselves may be staying in a car or whatever, but they don't want to go to a shelter for whatever reasons, or can't because of the age of the children. I think some of these statistics are going to change if HUD takes on the terminology of McKinney-Vento to include a lot of the people that I see as homeless that never show up on these statistics.
Yeah, I mean, sure. One, it will like exponentially increase the number of people who you consider experiencing homelessness. And I think it always goes, I mean, this is just my opinion. It always goes, I mean, part of this is also, it's intimately linked with prioritization and how we're prioritizing the scarce resources that we have. So like, one is like, you can make dents in some of these, but you always have to keep looking for the other populations, like you're mentioning, to make sure we're not leaving people out of housing opportunities too. And then just to your point of your comment of like, some people aren't allowed to go into shelter because of the age of their children, because of those things. And so if being in shelter is one of the primary mechanisms of getting into housing in this community, like why are people not being allowed to get in the first place, right? And that was kind of some of the other strategies that you'll see, is like, how can we make sure that we're being the most low barrier that we can, that we're accepting the most households that we can, the most people that we can. And so those are all, I mean, I think that the way the plan's written too, I just want to say it is broad. I mean, you can pivot within the plan if things like a different definition from HUD is coming through or things like that. I mean, recently HUD has allowed for doubled up to be allowable in some of the COC program funding, but I think it's hard to include the education definition and who gets housed, because there's so many other people who've have extremely long periods of homelessness. And so those are just always the hard decisions that any community has to make. But I think they're critical things to keep in mind when we're thinking about who we're serving, who we're prioritizing, and how we're making an impact on homelessness. So I just wanted to end on homelessness prevention. So it's working. It's awesome. You're doing a great job with homelessness prevention. You have a high number of people enrolled. Again, almost all of them exit to permanent destinations. Many of them, that's their first, and for many more, it's their only access point to the system. Really, you have a really low rate of returns with that. And so again, and a really high rate, 98%, that homelessness prevention is their only thing they access, and that's the last thing they access. So I want to just end on, you won't see like strategies around homelessness prevention, but because you're doing such a great job on it, that doesn't mean it doesn't need to be expanded. I think with some of the other things that are happening, we may need to understand you may need more resources for that, but the resources you have seem to be working. We can always use more resources, but you shouldn't worry that you need more homelessness prevention, for example. So I'm going to just shift over to the implementation structure. And some of you have already heard this as well. So the implementation structure that the steering committee is looking at, and this is the directionality that I was talking about, is really to look at kind of a hierarchical model where you have a high level strategy or policy board, and then the Heartland Continuum of Care Board would function more as an implementation board. And so what the strategy board would do again is, and again, this is what the direction that the steering committee is going is high level decision making and oversight of policy, aligning resources. Those of you who do this work know that the hardest part of the job is figuring out more resources to bring to the system. And so that taking that work away from the Continuum of Care Board and putting that at a higher level board, we see that to be more efficient and effective because that board, the strategy and policy board would be made up of key decision makers and people who have access to resources that they can bring together. So again, the steering committee is working on who those folks would be, but in general, we see that being a high level people like from the mayor's office and the county and from the housing authority and from healthcare and from philanthropy, who have high level resources to do those sorts of things. They also monitor and communicate the progress of how you're addressing homelessness to them, but also to the greater community. Whereas, how this would affect the Heartland Continuum of Care Board is it probably wouldn't affect the board very much, except that instead of having to worry about where funding and resources are coming from, or worrying about, that the plan is moving forward and that we're making progress on that plan, the board and the continuum of care can focus on what your expertise is, which is ending homelessness and implementing programs for people who are experiencing homelessness. And so it's really the implementation of the strategies of the plan. It's utilizing the funding that's identified and brought to the community. It's really keeping in your decision making and your oversight over your own homeless programs. So it's the strategy board is not the board that's going to tell you individually to change those policies, but instead it may be that they are asking the community as a whole to work towards a certain policy, and how can you do that together, and then implementing HUD mandates. And so that's kind of a given. We need someone in the community to do that work that HUD wants us to do. So this doesn't necessarily affect the board or how the membership of the board will be. You may find as a continuum of care that you may want other people on your board because of how implementation is going, but this structure doesn't necessarily would not make any changes to how the board is now. Both of these boards, I will say, need staffing. So you have Josh right now as your staff person for the Continuum of Care Board, but in order to really move the strategic plan forward, there's going to be a need for a person or some staffing in order to make sure that policy, strategy, and policy board is moving forward. Underneath the Continuum of Care Board is task groups and committees. These may be your task groups and committees that you have now, but it may be that other groups and committees need to be formed in order to accomplish things in the strategic plan. And often those are time limited and they're not things that are going on in perpetuity. So this is just the directionality that the steering committee is going in. I would say one of the big things they're grappling with the strategy board is how to maintain or reflect the great diversity of the community of Springfield and Sangamon County. So making sure that those key decision makers are as diverse as the community you all are living in. So that was one of the big conversation points with that. And they're still working out like how we would determine who the members are, how they would be decided, what are those rules. And so those are just all, just wanted to give a little bit of like direction wise. So when you hear things or the plan comes out, you're just like, where did that come from? We didn't know about that. I think I took way more than 15 minutes, Josh, and I apologize for that. But I am going to stop sharing and stop talking.
Oh, that was fantastic, Karen. A lot of great information. So I know for a lot of folks, those that are on the board or perhaps on other committees we've been sharing some of this as we've gone, and then we've been providing more brief updates to this group. So I guess one thing I would say to this larger group is this is a great in-depth introduction, and as Karen said, we're getting close to having this draft ready to share, and so there's certainly going to be more opportunities to dig deep into it and to converse around it. But I think we would, if there's any questions or thoughts that pop up immediately, we could take some time to kind of address those.
Josh, there was one question whether the slides would be shared. Will we have an opportunity to have these slides? Of course, I know we always have the recordings of the meetings, so.
Oh, I didn't know it was being recorded. Yes, we can send out the slides. That's no problem. I'm just kidding. We can send out the slides.
Okay,
That's no
Karen, we're
problem.
holding you.
Yeah.
If we can put those in the follow-up email with, like I said, just put some great stuff together that we can include in that as well. So.
It's Melissa. I just had a quick. All right, can you guys hear me?
We can hear you
now. You were cutting out. Yep, you're good.
Wondering, in years past, we have had there could be some participation from city representatives, but not necessarily voting members because they are a funder. Does that, in this kind of new setup scenario, does that take that type of activity into consideration, or?
I think I think it does. I think the way it does is by having those having the city on the strategy or policy board instead of being the ones integrating with the continuum in order to do that decision making. So I mean, it depends what funding source, and depends how that funding source is, whether the city can participate in that. But in general, the city may live, and the county board and some of those other entities, those governmental entities may live at that higher level of the policy and the strategy board.
And I also wonder if it's a common, if this is a common or a routine structure for continuums of care across the country.
Yeah, I think it depends. So I think we presented a variety of structures to the steering committee and talked through how they would work. I think they felt that the hierarchical structure would be best suited for your community now and where you all are at. So there are other ones that work, and they work for different reasons. One of the benefits of this one is a little bit of the separation of roles. And so high-level policy and resource development is held with the people who have the power to make those decisions and make those changes, especially with funding. And the continuum continues to, and has the luxury, I will say, as someone who has worked in such a structure like this, that you get to do what you do best and what you would prefer to focus on, which is implementing homeless programs and making sure that they're running correctly and making sure they're serving people. This, inherent in this model, I want to say, is a high level of communication between those two boards and a high level of interaction with each other. And so that staffing piece, those staff members are critical to doing that. But I mean, we do see other models. We do see, I mean, and Josh, maybe you can speak more to the feelings about this, but it didn't feel like some of the models are just like you take your continuum of care board and you expand it to include everybody you need to implement your strategic plan. And that didn't feel like the right model for Springfield and Sangamon County, because I think, and Josh or Amy or someone else or Stacy can, like, I don't think the steering committee didn't want to take away from the great work you all are doing and the cohesion to put another thing on your plate, right? Because you're already, honestly, the last 2 years with COVID has stretched everybody to a place that we've never been stretched before. So adding the implementation and monitoring and doing everything for the strategic plan seemed like not the best thing for the continuum to take on. So, but again, it's a draft, and if this group feels strongly in a different way, but in my opinion, I think this model really does, and having worked in kind of a similar one where I worked before, like this does work, and it does alleviate a lot of the pressure of some of the high-level policy decisions and high-level funding decisions and things like that, and lets you do the great work that you're already doing.
Thank you.
We can include, I know the board has discussed the draft at the last meeting, but we have a draft of the structure that sort of spells out a little bit more of who would be on these boards. And so it would include, agency representation on that board. And I think in the conversations among the steering committee and with the agencies represented on the strategic plan steering committee, one of the things that really stood out is the natural pathway this builds for the support that we often, I feel, perhaps I could speak for myself, but a lot of times I feel like the community looks at the continuum and says, hey, solve this, while providing, maybe 20% of the resources needed to solve this. And so one of the things that this structure does is build in broader accountability for providing the resources we need to offer the services that we know are needed. So that was a big selling point, I think, in this model. And then I think the opportunity to free the continuum up from some of the things that the continuum, we might get bogged down on a month on something that could be given to this board. And in the meantime, we can focus on the services that we want to offer and how we can better collaborate to offer those. So, and out of that conversation, those were some key points, I think, that helped us lean in this direction.
Can I jump in, Josh?
Go for it.
Okay. And of course, I'm going to speak on the data. So I totally agree with what Karen is saying as far as our exit destinations, but I also have to acknowledge the fact that since we have been doing the LSA, that particular category has drastically gone down if you look at it year to year. So I have dealt, I'm trying to reassure my users that I know are on this meeting that they are working towards it. They are getting there. It does take time to get there. And as far as the missing data goes, I also I'm not trying to go against Karen. I'm just trying to reassure my users because they are, constant. I'm in constant contact with all of the users, and they're always asking me questions and way more interacting with me. There are some issues that come up every 2 years when HUD decides to do these data standards changes, adding things in based on the time frame we gave Homebase as far as all of the data. I'm not going to say a lot of that. A significant portion of that are clients who maybe came in and left in that time frame. Now all of a sudden we have this new thing and it looks like a lot of missing data also. So, I just don't want my users to feel like, damn, I've been trying really hard and we just kind of got shot down on our data is all, so it's not just that you guys aren't doing it. There are other little reasons here and there. And I will commend them on the exit destinations just because I have been working on getting that from a little bit higher number down to, let's see, the 2021 LSA is down to 12.2% missing destinations. So compared to as a whole from 18 to 21, it was almost 43%. So
And that's incredible work, Tracy. And I think the reality is, apart from you,
It's not
and
me, it's them.
that's what I'm saying. Apart from you and the users you're working with, most of us have no clue how complex that is to pull that together. And so we do want to recognize that you're doing incredible work. And that is, I think the work that you all have done has provided the ability to do this analysis, which I think one of the important, and I think we want to come into this with open hands, right? And say, okay, what does the data show us, and how does that drive the strategy, as opposed to saying, well, we know what's needed, let's line the data up with what we know is needed. And so I think one of the great things that we're sort of seeing is, a lot of the hunches our service providers are saying, we know we need more of this, and we know, and the data is lining up with local expertise, I think, in a great way. And then also, helping to push us some too. So we certainly acknowledge everything you're saying, and thank you for sharing that.
Yeah, the message is not 100%, Tracy, not like we think there's anything wrong with the data. You're all doing a great job and the best that you can. We just wanted to, people always ask about like data quality, and we just wanted to just acknowledge that point. But there's no, that is not the message of like how you're entering and doing data for anyone on this call. Like, keep doing what you're doing, because it's a process that takes a long time, and we appreciate you all so much for what you're doing.
Thank you. I just didn't want them getting disheartened.
Yeah, don't be disheartened. We're not saying your data is bad. We're saying
all you guys are doing good.
Doing a great job.
Well, thank you, Karen. Oh, go ahead.
I was going to say, I do think, just really quick, one of the highlights of that, right, is you look at all that data, look at all the incredible work that goes into it. How do we bring that forward on a frequent basis as a community? How do we work with more, real-time data to make the decisions that we're making around prioritization? And so that absolutely is something that I think, being able to look at that data, I think we all, the nerd in all of us gets a little excited about that, I think, and says, how can we keep building off that and using that in the most effective way? Because the work's being done to capture it, and we need to leverage it.
Okay. Well, thank you, Karen. We really appreciate your time today, and look forward to perhaps another meeting in a few months when everything's all put together. Well, thank you. We appreciate it.
Thanks, everyone. Have a great day.
Okay. We have some trauma-informed care training opportunity. SIU Survivor Recovery Center is going to host a virtual trauma-informed care training on May 11th from 1 to 4. So if you want to put that on your calendars, you'll receive some registration information coming up soon. Equity, diversity, and inclusion training opportunity. Josh, you want to talk about that just a little bit?
Yeah, absolutely. Yeah. And I just would encourage anybody for that May 11th, go ahead and put that on your calendar. In talking with SIU, I believe the registration essentially is they're going to give us a link to send out to you all. So it'll be a very simple process, but and that will be a virtual training.
Mm-hmm.
And then we have, I know some of you are working on DHS and other grants. And one of the goals that we've had as a continuum is to put together more trainings for everyone this year. And so we're working with Memorial Health's Office of Equity, Diversity, Inclusion to plan a 4-hour equity, diversity, and inclusion training. We're looking at late June or at some point during July. So we're still working to get that date nailed down, but want you to know that's something that's going to be coming. That training at this point is looking like it will be an in-person training.
Okay, thank you. Some of our old business, just kind of exciting news. We've got 111 people that have been trained in our ambassador training. So if you haven't had an opportunity to go through that, we encourage you to do that or pass along the word so that we can get more and more people in our community trained. Just a little reminder too about our general membership renewals. I think Josh is going to put a link in the chat box for everyone to make sure that they get signed up for this year. And then we have some agency updates. I know Penny had said she'd like to speak on something. Penny, are you available now?
I am. So I just wanted to take a second and talk about some of the COVID money that Fifth Street Renaissance is utilizing for homeless prevention. We do have a significant amount of money remaining. We actually have 2 programs, the Emergency Rental Assistance Program and the ESG CV program that we are working on. And so we want to make sure that everyone has the information, can refer people to the program, and we really need your help to make sure that all of this money gets spent. And so when I speak about COVID money, the case has to have been somehow affected by COVID. Doesn't have to be this week or this month. It doesn't have to be last month. There are different guidelines for each program, and I'm not going to go into specifics about each program, but know that the person has to have been affected by COVID, either in their household, through their employment, through being infected, and they have to have proof of that. So we can take proof of that from a doctor, a hospital, a Walgreens, a CVS. The only way that we can accept proof from a home test is if that home test is also backed up by, let's say, a show in decrease of income on the paychecks, or a letter from the employer that says, yes, this person had COVID and they were off work for X number of days, weeks, months, whatever. So we can pay lots of money towards getting them back on their feet. One of the programs can go up to 6 months back and a few months forward. So there's really opportunity to get some relief into our community. Our staff are working with landlords and real estate companies to try and help their clients, but we know that there's people that we're missing. So we just really want to encourage you to refer people to the program and to let us get them assisted. And so they can get to the program either by calling 544-5040 and leaving a message at extension 10. Please tell them to only leave one message. We have a high number of calls every day, and so multiple messages just confuses the process. If you have a case that you really want to advocate for, you can send an email either to myself at pennypowellfsr@gmail.com or to Teresa Pickrell at Pickrell, Pickrel, Teresa, TERESA, FSR @gmail.com. So, if you have people, please let them know, please spread the word, and help us to get these folks served.
Is there an end date for this, Penny?
We have, one of the programs is going to end for certain June 30th.
Okay.
The other one may go until September. We're not sure. We're waiting on word from DHS. We know the
Okay.
feds have changed the guideline. We're waiting to see if the state's going to.
So it's a perfect opportunity right now.
Absolutely. Absolutely.
Would you put the number and those emails in the chat, and then even if you were Teresa, if you could put together a quick one sheet on that, we could send that out to the general membership as well, and kind of blast
Sure.
that information out there and encourage everybody to do it as well.
Absolutely.
Yeah, thank you, Penny.
Uh-huh.
Any additional agency updates?
Oh, yeah, this is Fuluke from Housing Action. I just want to give a quick update about the source of income bill. I think after 20 years of fighting for source of income, it did pass the House and the Senate, and we're waiting for the governor to sign it into law. And so Illinois will become the 20th state to have a source of income protection bill that passed. So I just want to say thank you to everybody that has advocated for the bill and has done all the action calls that we sent out. So it's a great victory for everybody just to have that into law.
Yeah.
Yes, thank you, Fuluke. I appreciate that. Anyone else?
I do. This is Dee at Salvation Army.
Uh-huh.
And I just want to put out there that through EFSP, We receive $4,000 for hotel stays. We ask that if anybody has someone they're working with and needs just like temporary emergency shelter in a hotel until you can get them into a bed or get them housed, let me know. It does have to be a referral from the agency. Please do not send a Jane Doe down here saying so-and-so told me to come get a hotel. But it is only $4,000. It will go quick, but it is available to community agencies through the Salvation Army.
Thank you, Dee. And it just not necessarily connected to that. One of the questions we're getting a lot is about the overflow shelter. I think in the community, obviously our pattern has been for that overflow shelter to close down as temperatures rise. So just want to reiterate that when the city funded that last year, they funded it for a full 12 months. So that funding is through October of this year. So the overflow shelter anticipates staying open, continuing to work in close coordination with other shelters. So just want to make sure everybody knows that. I think you likely all are, but.
All right, it looks like if there are no additional updates, just a reminder that our next meeting will be May 19th at 9 a.m. And Josh, are we thinking about getting together in person soon or not?
Yeah, I know the board has been kicking that around, so we'll allow the board and executive committee to kind of help guide us on that. So it is certainly a conversation that's sort of taken place at that level.
Okay, well, we look forward to seeing all of you in person one of these days soon. So if I can have a motion to adjourn.
I'll make a motion.
Thanks, Penny. A second.
I'll second.
I'll second it.
Thanks, Melissa. Thank you. All in
Coordinated
favor?
entry, stay on.
Yep.
Yeah, coordinated
I
entry,
always got it
stay
right.
on, sorry. All right, everyone.